Hello hackers, my name is Ben Taylor. I'm a pharmacist on the product development team at CVS Health. During my time at CVS, I've come to realize how important medication adherence is to our patients. Medication adherence is an enormous challenge in healthcare. Often medication adherence costs our healthcare system $1 billion annually. It also has deep personal impacts, with more people getting readmitted to the hospital, poor treatment outcomes, and even preventable deaths. I'd like to share my story on why medication adherence is important to me. In the summer of 2002, my mother was diagnosed with stage 4 breast cancer. During that time, I was an undergrad in college, unsure of what I wanted to do as a career. As a way to help my family deal with my mom's healthcare treatment, I decided that I would help my parents pick up medications at our local pharmacy. Prior to this time, I had never visited a local pharmacy as our family was relatively healthy, never in need of acute or chronic medications. As I started to frequently visit the pharmacy, the head pharmacist at this location started to recognize my face and knew that my mom was sick based on the medications that she was getting. He took a real personal interest in myself and in my mom and in my entire family. He went out of his way to make me feel important and explained to me why her medications were important, how to give them to her successfully, and explained to me that by being adherent to her medications, she could remain strong and remain adherent to her cancer treatment protocols. He often went out of his way to show me the special ways that the medications could be taken and what side effects that she may experience. As my mom's condition worsened throughout 2003, she was put on less common treatment plans, which meant she was put on more expensive medications and medications that were hard to obtain and often not covered by insurance companies. I specifically remember an example where she was put on an oral lozenge pain medication called Actique because she was no longer able to swallow tablets. This medication at that time was relatively new to the market and not covered by her insurance company and very difficult to order by the pharmacy staff. The head pharmacist took the time to call up my mom's oncologist office and insurance company to ensure that the medication could be available for my mom at an affordable price. He went out of his way to make sure my mom was adherent to her pain medications and make her final days as comfortable as they could be. I know without the efforts of that pharmacist, my mom's final days more painful and more stressful for our entire family. This experience is ultimately why I chose to become a pharmacist. To have an impact on a family's life on a personal level and help a family understand their medications and increase adherence was what drove me to pharmacy school. As a practicing pharmacist for the last decade, I tried to really channel the experience I had with this pharmacist and affect patients on a one-by-one or personal level as best I could throughout my days in the pharmacy. Working now for CVS Corporate, I can now apply these principles on a more global level using the technology and advanced techniques we've developed to increase patient med adherence. I'm proud as a CVS pharmacist that we've sponsored this adherence track at MedHacks and hope that one day in the future you can increase medication adherence for patients across the world. Thank you.